Hello guys, so now we shall be discussing what are the different kinds of paranasal sinuses which we have got. So we will discuss about paranasal sinuses. So what are the different kinds of paranasal sinuses which you have got? First of all, let us write down some basics. Okay, what is the first basic is that what is this paranasal sinus? Paranasal sinus is nothing but air filled extensions of nasal cavity. So these are air filled extensions of nasal cavity. Air filled extensions of nasal cavity is called as paranasal sinuses. Next, second important thing is that how many paranasal sinuses we have got. See, here we have got two frontal sinuses. Okay, after that here we have got ethmoid sinuses, and the sinus which is present here is called maxillary, and here on the right and left you have got sphenoid sinus. Okay, so how many sinuses you have got? You have got four paired sinuses. Four paired sinuses you have got. What are these four paired sinuses which you have got? So one is called as the maxillary sinus. Where is your maxillary sinus present? Here, right? Next, okay, let us write from the top to the bottom. On the top you have got here two frontal sinuses. You have got frontal sinuses. Next you have got the ethmoid sinus. Ethmoid sinus, and this is ethmoid sinus, not bone. Okay, bone is only one, but sinuses are two. Okay, next we have got maxillary sinus, and next here and here we have got sphenoid sinus, which you cannot see from the anterior view, you can only look from the lateral view. Okay, so that is your sphenoid sinus. Sphenoid sinus. So there are four types of sinuses. What is the sinus actually? There are some open cavities within the face, within the skull. These are called as the sinuses. So third important point which you need to know is that each sinus is lined by ciliated pseudostratified epithelium. So each sinus is lined by ciliated, each sinus is lined by ciliated pseudostratified epithelium. Pseudostratified epithelium. What is the function of the sinus? Actually the function, regarding the functions of the sinus, this topic is really a debatable topic. So different textbooks tell different functions, but overall some tell that the sinuses, these are the empty cavities, right? So they are responsible for lightening the weight of the head. They are responsible for lightening the weight of the head. So that is one function. Second important thing is that they are supporting as an immune defense for the nasal cavity. They are supporting as the immune defense of the nasal cavity. Okay. Third important thing is that whatever air you take inside, they will humidify that air. Humidifying the inspired air. Responsible for humidification of the inspired air. And fourth important thing is that they are responsible to increase the resonance of the voice. For increasing resonance of the voice. So these are the important things. So lightening the weight of the head, supporting immune defense of the nasal cavity, humidifying the inspired air, and increasing the resonance of the voice. So these are some of the functions. Okay, let us look at these sinuses from the frontal view. So in this is your frontal view. Now in this frontal view, what are the different kinds of sinuses which you can observe? See, this sinus which is located in the frontal lobe is called as your frontal sinus. How many frontal sinuses are there? There are two. Next, here these sinuses which you can see is called as ethmoid sinus. Ethmoid sinus. Okay, so from the lateral side you can see that there are three ethmoid sinuses on both the sides. Whatever it is, they are in the pairs. the right side and left side. Next here you have got the maxillary sinus. Maxillary sinus. So that's what I was telling you, that you can look at the sinuses, these three sinuses only from the frontal view. From the lateral side, you can see another sinus over here. This is called as your sphenoid sinus. Sphenoid sinus. And again, this one over here is called as your frontal sinus. You see, these are called as your ethmoid sinus. Now, when I tell about ethmoid sinus, just rubbing out this picture, just concentrate on this picture over here. This ethmoid sinus are of three different types. See here, if I am dividing these ethmoid sinuses into three groups, this is the anterior ethmoid sinus, middle ethmoid sinus and posterior ethmoid sinus, right? So, there are three groups of ethmoid sinuses. And finally, this one over here is called as your maxillary sinus. Maxillary sinus. Okay, right. So, the first important sinus which we shall be discussing is your frontal sinus. Frontal sinus. Now, when it comes to the frontal sinus, you see these sinuses on right and left, these two are called as frontal sinus, right? And this frontal sinus, you see, it is with the help of some duct, it is draining down into the nose. Now, within the nose, you have got three meatus. What are these meatus is that, for example, if you look at the medial wall of the nose, this is how it looks. Here, you have got three important meatus. See, here there is one meatus, this is another, and this is a third. One is called as the superior meatus, middle meatus and inferior meatus. Let us say that this one is a superior meatus, this is called as a middle meatus and this is called as a inferior meatus. Okay. So, what I am telling you is that this duct whatever is there, let us say this picture which I have drew here, this is from your lateral side. I mean from the side of your face, if you are looking at the, if I am cutting this down into two, from the side if you are looking, this is how it looks. This is on the medial wall. Okay. This is on the medial wall like this. So, here is your eyeball like this, right? And you know that there is a sinus here, this sinus over here is called as frontal sinus. What I am trying to tell you is that this frontal sinus, with the help of a duct, it drains into the middle nasal meatus. So, whatever secretions are present within the frontal sinus, they drain into the middle nasal meatus. Okay. And what is the name of the duct? This duct is called as frontonasal duct, from the frontal sinus to the nasal region. So, frontonasal duct. Okay. So, you need to write it down here as frontal sinus drains through frontonasal duct. Frontal sinus drains through frontonasal duct. And important thing here is that this duct finally enters where? Which meatus? That is a middle meatus of the nasal cavity. Middle meatus of the nasal cavity. This duct enters into the middle meatus of the nasal cavity. Now, if you look at the frontal sinus, what is the nerve that is innervating this frontal sinus? The nerve is, where is the frontal sinus present? Above the orbit. So, above the orbit, the nerve that is innervated is supraorbital nerve. Supraorbital nerve. So, if you have watched my lecture on the ophthalmic nerve, which is a branch of trigeminal nerve, so supraorbital nerve is a branch of ophthalmic nerve. It is a branch of what? It is a branch of ophthalmic nerve. It is a branch of ophthalmic nerve. Next, what is the artery? Okay. So, what is the artery over here? Artery is anterior ethmoidal artery. Anterior ethmoidal artery. And what is this anterior ethmoidal artery? It is a branch of internal carotid artery. It is a branch of internal carotid artery. Okay, anterior ethmoidal artery is a branch of internal carotid artery. Clear? So, this was the thing I was telling you, that let us say that this is your frontal sinus, this is your frontal sinus for example. From the frontal sinus, you see the duct that is draining here, you see this gap here, this is called as superior nasal meatus, this is called as middle nasal meatus and this is called as inferior nasal meatus. So, it is directly draining into this middle nasal meatus. Now after this, the next important thing we shall be discussing is your sphenoid sinus. Sphenoid sinus. Okay. Now in this sphenoid sinus, again I am telling you, right? So what are the three important meatus? You see there are three important structures. Beneath these three important structures, there is a gap. You see there is a space like this. For example, let us say there are three important gaps. See, this is called as superior concha. This is called as middle concha, and down here inferior concha. Okay. So I can tell you like this. This is superior concha, middle concha, inferior concha. Beneath the superior concha, this space is called superior meatus. Beneath the middle concha, this space is called as middle meatus. Beneath the inferior concha, this space is called inferior meatus. You can look here that this particular concha is called as superior concha. Superior concha. And this one over here is called as middle concha. And this one over here is called as inferior concha. Okay. Next, beneath the superior and middle, this gap which you can see, this is called as your superior meatus. And this gap, whatever you can see, is called as your middle meatus. And this gap over here which you can see is called as the inferior meatus. Inferior meatus. Okay. Superior meatus, middle meatus and inferior meatus over here. Where are they located? Between the superior concha and middle concha, you have got the superior meatus. Between the middle and inferior concha, you have got the middle meatus. Between the maxilla and the inferior concha, you have got the inferior meatus, right? Now coming to this sphenoid sinus, where is this sphenoid sinus present? This is your superior concha, right? So superiorly is this and posteriorly, exactly here you have got this. What is this location? Supro-posteriorly, right? Superior posterior to superior concha, we have got this sphenoid sinus. Now, if I ask what is the nerve that is innervating this sphenoid sinus, what will you tell? The nerve is posterior ethmoidal nerve. The nerve is posterior ethmoidal nerve. Next, what is the artery? If I ask you, what is the artery? That is called as your maxillary artery. Maxillary artery. So, posterior ethmoidal nerve as well as the maxillary artery. Now, one very important thing I want to tell you here is that there is something called as sella turcica of the sphenoid bone. If you can look at this picture here, see, this is your sella turcica of this particular bone here. This particular bone is called as a sphenoid bone. Within this sella turcica of the sphenoid bone, you have got pituitary gland. Let us say patient is having a tumor of the pituitary gland. So, how do you operate? From the nasal cavity, you puncture this particular sinus. You see what is this particular sinus over here? This one, sphenoid sinus. So, from the nasal cavity through the sphenoid sinus, look here, I am rubbing all this out. From the nasal cavity through the sphenoid sinus, you enter into your sella turcica of the sphenoid bone to do the surgery. And what is the sinus here? What is this sinus here? This is called as your sphenoid sinus. Okay. So that is why this kind of surgery you call it as trans-sphenoid surgery. Trans-sphenoid surgery or trans-sphenoid resection of your pituitary gland, the tumor part of the pituitary gland. After that, the next important sinus which we shall be discussing right now is your ethmoid sinus. Ethmoid sinus. Right. Now, when it comes to the ethmoid sinus, you need to understand one very important picture. So, this is your anterior cranial fossa here, and you very well know that the sinus that is present in the frontal region is called as frontal sinus. Behind that, you have got ethmoid sinus. See, this is one ethmoid sinus, ethmoid, and here you have got another important sinus. I will tell you in a minute. So, let me shade this part. See, this particular sinus over here is called as your frontal sinus. After frontal sinus, this is called ethmoid, and ethmoid. What are these three ethmoids? See here. This ethmoid over here is called as your anterior ethmoid, and this is called as your middle ethmoid, and this one is called as your posterior ethmoid. So all these three important things are your ethmoid sinus. Ethmoid sinus. And what is this one over here? This is called as your frontal sinus. Frontal sinus. And what is this particular sinus at the end? Again I am telling you, this is your sphenoid sinus. Now why did I drew this picture? The reason is that within the nasal cavity I told you, there are three important things. See, this one is called as meatus, this is another meatus, this is another meatus, right? So what did I tell you? I told you that this particular meatus is called as superior nasal meatus. Next, this particular meatus is called as middle nasal meatus, and this particular meatus is called as inferior nasal meatus. See, this is middle nasal meatus and this is your inferior nasal meatus. So what I am trying to tell you now is that the anterior ethmoid sinus and the middle ethmoid sinus, they directly drain into the middle nasal meatus like this, okay, whereas the posterior ethmoid sinus, they drain into the superior nasal meatus, okay. So what are these? They drain into your superior nasal meatus. So this one is your superior nasal meatus, this one is your middle nasal meatus, and this one is your inferior nasal meatus. So these are all the discussions regarding your paranasal sinuses, okay. So this is what we were discussing regarding the paranasal sinuses. These paranasal sinuses are the air-filled extensions of nasal cavity, first point. Second thing, four-paired, frontal, ethmoid, maxillary and sphenoid sinus. Each sinus is lined by an epithelium called as ciliated pseudostratified epithelium. Function, they make the head of the, they make the weight of the head little bit lighter, support the immune system of the nasal cavity, humidifying the inspired air, and the voice, increase the resonance of the voice. So these are the sinuses over here, right? This is on the sinus on the lateral view where you can very clearly visualize the sphenoid sinus. So this was the surgery I was telling you, transsphenoidal surgery in this way, okay. Through the nose, they directly cross the sphenoid sinus and enter into the pituitary gland. So this is the duct. Frontal sinus is draining into which meatus? It is draining into the middle meatus, very important, okay. So nerve is supraorbital nerve, artery is anterior ethmoidal artery. Okay, so here you can see it very clearly. The artery in the frontal sinus is the anterior ethmoidal artery. The artery in the sphenoid sinus is the posterior ethmoidal artery, right? So this is the basic difference which I want you to know. So that's it. These are the discussion regarding the sinuses. Thank you so much for watching my video. Goodbye.